Jose, you got me?
Yeah, it's not letting me do video.
Uh-oh. Try now.
Try it again. There we go. Cool.
Let me turn my video on here. How are you doing?
Good.
Are the kids out of school?
They're back one is back in school, one is only in daycare 3 times a week. So
Nice. I don't know if you got a notification for that severe storm that's supposed to be blowing through here, but I'm not really seeing much of
okay,
it.
so
I'm a little confused.
yes, I got one about it, but for us, it's not supposed to be that bad, especially since we're in
St.
suburb
John's.
St. Augustine rather
Yeah.
than like Palatka Elkton. If we're in Palatka Elkton, yeah, there might be tornadoes, but I haven't seen a tornado touch down in St. Augustine proper
We're in
ever.
I guess from you it'd be northern St. John's County, but they just announced that school's getting let out an hour early, so
Yeah.
that's it. But I think
Yeah,
Duval,
that's all. St. Johns
Nassau,
County
and
is the only one doing that. Everybody else in the area is like,
everybody else is going to school. Duval, Nassau, I think Clay County as well.
yeah, they
They're
all
all out
canceled.
today. It's crazy. But I'm over here in the office is in Duval County. It's not that bad right now, so I don't know
No, it's
if it's
supposed to
supposed
be
to.
bad at 2:30, but I don't know how it's supposed to be so bad for 2, 3 hours and then nothing. Like
Right,
I don't quite understand that. But I mean, then again, I'm not a weather person,
right.
so
It's unpredictable, I guess. But I thought it was going to be worse now, but I guess it might. I guess you said at 2:30. That's an hour
yeah,
from now. Huh.
yeah. We'll see how it
All
goes. I
right.
mean, it won't be worse than a hurricane,
Now,
so
yeah, right. So looks like we got some joining in. Jamie, how's it going? Shelly, good to see you back. Sherry, good to see you as well. Happy New Year. Hope you guys had a good Christmas and New Year's, and we're looking forward to a good 2024 year and the continuation of these webinars. Hope you guys are getting some value from this. I know Shelly is. She's attended several of them. I got a little trivia that we're gonna do today, Jose. I just did one question from last week's
let's go for
presentation.
it.
This one will actually be interesting because I don't think any of the attendees that are in here right now have or were on last week's webinar. So this will be an interesting question, but we'll give it another couple minutes and then yeah, we'll get it going.
And then Ray, so you know how I told you I would look up the website that we were looking up last week?
Yeah, I have it up. I found
Three of
another.
the
Go
three
ahead.
of the first four,
Oh, I
three
know.
of business associates.
Are you talking
And
about
I just
let's see, the hacking IT incidents?
yes, the hacking
Yeah,
IT
yeah,
incidents,
yeah,
the
yeah.
unauthorized disclosure and access.
I have the website up. We can certainly talk on that. I have an example to show as well. Um, it's older. It's from 2018, but really just wanted to emphasize
Yeah, yeah, yeah.
the cost of these things of not having these agreements in place,
It's
and
wild.
it's nuts. It is, and like I said, it can put you out of business. Let me tell you.
I mean, and these were just reported last week.
I know
Since
that's
we did
why
it,
this. I'll post this in the I'll post this in the chat for everybody right now that's in here. I'll post it again during the presentation, but everybody
yeah,
that can hear us. Last week's presentation, we were actually talking about breaches, and this link that I just provided over here in chat. This will take you to the U.S. Department of Health and Human Services breach portal, and this is basically real-time updates of breaches that are occurring here in the U.S. and it'll tell you the type of breach, if business associates were involved, etc. And ultimately, you don't want to end up on this list.
yeah, it means you have more than
No,
500, 500
500 affected individuals,
affected
or
patients.
yeah, and that'll also tell you here how many individuals were affected as well. So overall, don't want to end up here. And hopefully the presentation today will provide a little bit more insight on business associate agreements and its importance. I'll tell you right now, it's 1:36. We'll get one more minute, Jose. I sent
All
out
right, sounds good.
I sent out a reminder sort of late, one about 30 minutes before this
Yeah.
presentation, but just wanted to see if we get a few more in here. Timothy, welcome to the webinar. Let's see who else we got in here. Brenda, welcome to the webinar. In the meantime, I'll go ahead and just get the trivia up here. Hang on just a second.
Yeah.
Jose, you're not involved in this, by the way. You can't put your answer over.
Oh yeah, I never did.
All righty, let's go ahead and get going. So for those that just joined, I appreciate you joining in today. Just for fun, getting the brain juices flowing, we do a little bit of a trivia before we get started. This question is related to last week's webinar. We talked about breach notification rule and the breach notification portal. And here's the question. And Jose, you can see, correct? Just want to make sure.
Yeah.
Okay, great. So, and you guys can provide your answers in chat. It's going to be multiple choice. Under the breach notification rule, what is the time frame for covered entities to provide individual notice, written or email, after a breach was to occur? And those choices are going to be A, 30 days, B, 45 days, C, 60 days, and D, 90 days. You guys can go ahead and list your answers in the chat for us. We'll give it a second. Don't be shy, guys.
Now this one's interesting though, because when speaking to lawyers and going through everything, it's from the time frame of discovering the breach, not from when the breach occurred.
Interesting.
So
I'll
because
tell
you
you
can't
right now, the
report
answer that
something.
I got is from the Department of Health and Human Services, but that's a good argument, you know.
Well, it gives you it's the you can't sometimes you can't sit here and go and say, hey, I didn't discover this.
Sure.
It may the breach may have occurred 11/1, but we're in 1/6 of the next year. I didn't know it happened. Now I got to
That's a
figure
good
out
point.
how many people are affected and all that stuff. So it's from when the breach was discovered, not from when
Discovered.
it occurred.
Okay. No, good point. But Sherry said 60. I'm a loser. I'm gonna guess.
Shelly,
Shelly,
you're
go
not a
ahead.
loser.
Listen,
You can
Shelly.
catch up by watch Ray will send the link to everybody so that way you can see the last week's.
Shelly, I'll send you the raw footage. It's not on YouTube yet, but what I can do is send you the raw cut of it. But take a guess. Why not?
Yeah.
We'll wait on Shelly's answer and then we'll go through it.
Oh, she guessed C.
Oh, did she? Oh,
Yeah.
hey, I'm sorry. I can't read apparently.
It's the second sentence.
So the answer is actually C, 60 days. And this is all in terms of this time frame. This is set forth by the Health and Human Services Department. But to Jose's point, I do, according to attorneys, it's at the date of discovery, which I would assume. I guess that would.
It's more lenient in that respect because
Right,
again,
right.
like if you have a situation where it's day 59 that you find out the breach even occurred, or it could have been 180 days, you have no idea.
Right.
But once it's found, that's when the clock starts.
No, it makes sense. Makes sense. But Sherry, congratulations, and Shelly, good guess.
She gets C like every multiple choice person does. You were nice though. You put it in order 30, 45, 60. You couldn't even mix them up a little bit just
stop.
to
Oh, stop. I'll do it next time. How about that? We'll throw some trickery in
perfect.
there.
Perfect.
Context clues. All right, I gave it away. Whatever. All right, guys. So let's go ahead and get started with today's presentation. Again, hello everybody. Thanks for joining us today on another compliance step-by-step webinar. My name is Ray Walters, and I will be your host. And I'm thrilled to be co-hosting yet again another episode with my guest, Mr. Jose Delgado. Uh, Jose has over 17 years of experience in business development, healthcare management, and consulting. His latest venture is owning a mental health telehealth clinic. And today Jose and I are going to be expounding on, there was a presentation, I think back in December, I interviewed Dr. Delgado. We sort of talked about the baseline of what a business associate agreement is. Today, we're going to be sort of talking about how to navigate these relationships, how to attain assurances for business associate agreements, etc. Jose, glad to have you on. Anything that I missed that you want to add to?
No, so we'll do the 60-second TLDR if you missed the other one or you're kind of trying to figure out what we're talking about. Basically, we're talking about business associates. A business associate, according to HHS and court cases, is anyone that transmits, creates, or stores patient health information.
I'm going to go ahead and
I
skip
hear
that slide.
all the time how, oh, I'm not a business associate because I only X. No, doesn't matter. According to the federal government, if you create, store, or transmit PHI, you are a business associate. That's your billing companies, your IT companies, especially if they're doing active monitoring. If they're doing anything where they can take over your computer or take your computer to fix it, your printer leasing companies, your 1099 providers, your scanning, if you have a scanning company or vendor, if you have a dictation vendor, if you have so if you use Dragon speech to text, or you have a transcriber, those are you need a business associate agreement. They are covered, and they're not covered entities. They're business associates. Now, you don't need a business associate agreement if, for example, I am speaking to another provider or I'm speaking to someone else and it's in regards to treatment, payment, or operations with the patient. So if it's something that they would normally have access to this. So if I'm a primary care doctor and I'm speaking to a specialist and we share a patient, if we're talking about that patient, we don't need to get a business associate agreement. It's just a treatment, payment, or operations. So the reason why this is a big deal is you want to have a business associate agreement in place so that way you are not held liable if they mess up. Now, why are we bringing this up today? Because there's a lot of practices that like to leverage 1099 providers, especially the doctors, some mid-levels, different subspecialties in the practice. So we want to make sure that you are protecting yourself and your practice as much as possible, because what generally happens is that there is a subsection of the business associate environment in healthcare in the US that does not take compliance seriously. It's just the reality of the matter. Most IT companies take security seriously, but they don't normally understand the difference between HIPAA and just IT security. And there's a level of documentation that makes the difference there. Your providers in general are going to be your largest liability for compliance, a 1099er especially so.
Oh, yeah.
You definitely want to keep an eye on them.
Elaborate on the 1099, Jose,
So a
and
1099
why
is
they are important business associates.
Yeah, so they're an independent contractor. So I'll be honest with you, in our office, we have one 1099 provider because I have enough space in my schedule to where I need help so my providers aren't overwhelmed, but I don't have enough to where it justifies bringing them on full time. Or I have a subspecialty, so we're a mental health practice, but I don't want to bring on the counselors full time because of the same thing. I don't have the bandwidth patient wise or the
Patient, yep.
cash flow to support everything. So I'll pay them as a 1099. Now, there are certain rules that you need to follow based on the state that you're in for tax purposes. I'm not going to get into that today. Talk to your accountant. But the more you give them in tools to use, the less likely they are to be considered a genuine 1099. Now, what does that mean? If I follow the 1099 rules, so the provider has their own laptop, they have their own office, they have their own this, they have their own that, they pay for their own text to speech to text or transcription. They do all that fun stuff. They need to make sure that they are following these rules for HIPAA security. And a lot of times they're not. I'll be perfectly honest with you. It'll go as far as, hey, so that laptop that you're using at home for telehealth, or that laptop that you're using for your notes,
Right.
what IT company are you using? Oh, it's brand new. I just got it from Best Buy, and it's got
It's got a
Norton
McAfee.
on there or
Yeah.
McAfee on there.
McAfee.
I'm still on the free subscription for that.
Yeah.
So that's a problem. That's a giant red flag. The first thing you need to do after you get them doing 1099 is signing a business associate agreement. So if they mess
Yes.
up, it's not on the practice. You can hold them liable.
Absolutely.
Now, business associate agreement is essentially your shield to make sure that if someone messes up and it is not you, but one of your vendors, you are not held liable as the covered entity. Because back in the olden days, many, many moons ago, like 15, honestly, 10 to 15 years ago, the rule did not exist. So if your billing company screwed up, all of their clients were held liable for the billing company's screw up. So lawyers came through, the AMA came through and was like, hey, how do you expect me as a provider who's seeing patients all day? I already got to follow all your mess of rules. How do I manage my vendors? There's got to be a way that I
Right.
can get myself in a position where I can protect myself as a practice. I mean, that's just the way that it goes. So the federal government came into play with the business associate agreement. This is your first line of defense and compliance when dealing with vendors. We have a lot of problems with printer leasing companies that do not like these because it means that they have to deal with the printers in a certain type of way when they go and reuse the printers or bring the printers in or anything like that. They don't like dealing with that because of all the crud regulations involved with that. There are certain EHR companies that will give you their BAA. You will not get an opportunity to negotiate the BAA or give them yours. It's again, same thing. Insurance companies, when you enter into an insurance contract with them, you'll have a business associate agreement with them. Billing companies, IT companies, you should have a business associate agreement with them. If you don't, get one done.
Absolutely.
Your EPICompliance offers a business associate agreement on there that all you have to do is put in the information and it'll send it out to you. If you are one of those people that are a little bit more old school, maybe you have one on paper. You want to review it to make sure that everything is covered. Things like, hey, by signing this piece of paper, that business associate is warranting that they are following all of the rules that apply to them federally and state-wise for compliance. So you're talking about, hey, that means that they need to be doing an SRA. That means they have to have policies and procedures. It means they should have an IT department or company that is protecting their devices and making sure that they're not doing anything foolish with these devices. It means that the provider or the company is not using the same devices for personal as for work use just because of the amount of things that can be jumping onto your laptop by checking the wrong email or going to Temu or Wish or whatever,
Yeah.
So we want to make sure that we are protecting yourselves and the practice. So I think that kind of gets there. And if they're not willing to do it, you can fire them as a vendor regardless of what the contract says.
I was gonna say, Jose, I think the audience, maybe they're thinking of this, maybe they're not, but in terms of these agreements, is there any expiration date on them once you have them in
No, but
place?
you want to. it's an evergreen kind of an agreement for as long as the contract with your with the vendor stays in place.
Of course.
Realistically, you want to review your BAA every year. If you have a company like EPICompliance where they review it for you every year, all you want to do is on a piece of paper or on the form that EPICompliance has attached to that section, you just go and say, "Hey, we reviewed it. Any changes that were done, were done. Any ones that weren't. Reviewed, nothing changed, or reviewed, a few things changed," and then just move on. So it's just documenting that something was changed. Generally, the business associate agreement will change based on court cases or final rules that become applicable. One of the big ones right now is everybody's freaking out about safer guides, but safer guides are not a requirement as of yet. So don't panic, relax. You don't need to do anything. It's not going to affect your payout for macro and MIP. So don't just ignore it for now.
So
But anyway, so direct liability for business associates. We kind of went over this already,
I was
but
going to
these are
say,
big.
obviously, yeah, we did kind of cover this slide, but the slide mentions direct liability for non-compliance with security rule security rule requirements. Could you share a quick overview of what those requirements entail?
So yeah, so for example, let's say I'm a billing company and I have an employee that is mad at me and starts messing with different systems and quits. It's my job as the business associate to make sure that there is nothing there that they actually screw up. There are no
Of
records that
course.
they went and misplaced. There are, we need to protect the information. So that's where you have your different audit trails for HIPAA security, where you have your lock boxes or lock cabinets if you're HIPAA privacy focused, and honestly, probably a mix of both if you're billing, because EOBs still come in paper and in electronic format. If I'm a staffing agency, which this happens a lot, I get a lot of if I'm a facility and I get locum tenens, X-ray techs, MRI techs, mid levels, nurses, whatever. I, as the employment agency, have to make sure that they don't do anything stupid.
Of course.
Sadly, for HIPAA security and providers and lay staff members, this is a lot of common sense stuff. Like, are they treating the patient health information in a proper format, in a proper setting? Are they not searching for things they shouldn't be searching for? So if I'm in one facility, I'm not looking for patients that go to another facility just because I know them. I only should be having access or reviewing records that are involved with my patient care personally, as a provider, as a tech, as a nurse. I shouldn't be looking at things that are in different locations.
Sure.
A lot of EHR systems don't have a way to segregate by system, so it's really kind of a tricky spot for that one. That's where the audit rule comes into play, because then a manager can go and see what it is exactly any person who's logged on has done or has modified. When it comes to the failure to breach notification, again, that's the oops. If you're on last week's video, or if you catch last week's video, OCR has a website that puts all the naughty people on their list that have over 500 cases. And already we're in the second week, and there are already people that had to report last week. 3 of the 4 most recent breaches that are on the OCR website have to do with business associates messing up. It's just they're not immune. They have the human element.
I actually
We
have
just have to make sure that we're protected.
I wanted so, and guys, I'm gonna post that link in chat. I had posted it earlier, but I know we've gotten a couple new individuals in here since then. So I'm gonna post that link over here in chat, and you guys take a look at that. And actually, this slide here, it kind of coincides. This is interesting statistics, but this is from this study was conducted by the Department of Health and Human Services. This was conducted between 2009 and 2018 breaches. Obviously, to end up on this list, it has to affect over 500 individuals. And out of all the cases between 2009 and 2018, December 31st of 2018, business associates accounted for 16% of that list, which
I bet you. I
in
bet
my
you.
in my
I bet you a
opinion,
large pizza that if you looked right now from 2018 just to 2023, that number's jumped.
I was going to
Just
say,
because
and
the
that
amount
was,
of people that are
yes,
business associates.
yes. I would argue that this number is definitely increased. I was looking to see if I could find any sort of studies recently, but I
Not
thought
yet.
this was interesting. But I would argue that that number has probably increased since then. Why do you
Well,
think so, though?
so there's a couple of different reasons.
Yeah,
One, there's a lot more business associates running around in healthcare. As costs go up in a small practice, it becomes more financially viable to offload that to a different vendor. My
sure.
HR, my billing, my providers, like we just talked about, some of my staffing, the EHRs, the transcription, so like you're gonna keep going through and finding things that I'm like, I don't really want to do this, but I need to get this done, so I have a vendor. The reality of the matter is that from that 2009 to 2018, it's only 16% because I would wager half of the business associates in the industry were not tracking things the way they should, so they wouldn't even know
Yes.
there was a breach.
Yep, I agree. I think
There's just no way because if you're not doing the things you're supposed to do at the very minimum level of, hey, we have monitoring, we have passive monitoring going on with our devices, you're never going to know that there was a breach.
yeah, no,
It's
agreed.
just the way that these things work. So I would venture that that number is increased at
Yes.
astronomically if we took everything into account. But even right now, from 2018, so no, so January 1, 2019 to January, what are we on? 8, 9 of
Nine.
24. Geez, that's gonna be
Yeah.
weird to say that. 24. Those
It's
6
crazy.
years, it'll be higher than that. And it'll be a larger impact.
What do you think? What companies or business associates do you think that'd be the most impactful for? Would you say MSPs or billing companies? I mean, it almost sounds
So
like there's such a
interesting that you're mentioning MSPs because the other thing too is private equity that's been getting into the game of healthcare and
Mhm.
consolidation. They've been really trying to get out of the compliance aspect of it on a higher up private equity level because they don't want to deal with it. They know that it's expensive to do. But if they are an owner of the practice and they are bundling up 15, 20 practices so they can sell this off to an insurance company or get a better contract with an insurance company or whatever the case may be, so they can leverage the amount of patients they have, they would also be a business associate by virtue of treatment,
Sure.
payment, and operations. Because a lot of these guys, as the private equities, are offering one of the benefits as they are an MSP. So instead of me paying for an HR department all by myself, I'm sharing that HR department with 5 practices. I'm sharing an IT department with 10 practices. I'm sharing a compliance department that usually has an in-house attorney, different factors. A big one is billing. We have a macro and MIPS department that will help you meet those measures. Well, there's no way you're going to be able to confirm that you're meeting macro and MIPS without having access to patient health information.
Sure.
It just doesn't work. So by nature, all of these different organizations that didn't have to do this stuff before, they are. Now, the second you lose your virginity with this stuff, you're done. You gotta pay attention to it. So the private equity that wasn't in healthcare before didn't have to worry about HIPAA.
Right.
But the second they got involved with a medical practice, they've lost their virginity. Now HIPAA applies forever and ever and ever. The only way they're getting out of it is by getting rid of the company and starting another,
And
which they have done.
that kind of
It's just a
leads
matter of getting.
into the next segment and question for the or I'm sorry, question for you for the audience benefit. If you are doing business with a business, let's just say business associate, we'll just keep it general.
Yep,
But business associate is unwilling to sign business associate agreement. What do you do?
cancel the contract. Cancel the contract
That's
because
it.
it's not worth it to me. Because just like in the slide that's up right now, I love the fact that I have a business associate agreement in place because if there is a breach, I am at least sharing the financial damages by 50%. And if I can punt more of it, I'm sorry, vendor, you're SOL.
Mhm.
I'm saving myself. Like if I don't have that business associate agreement in place, they're coming for me. And they may
Absolutely.
just double dip. So they may say 10 million for me, 10 million from the vendor, and there is nothing I can do because I didn't have any warranties saying that the vendor was doing the stuff they were supposed to do. So we have to keep in mind, I mean, this is the literal example, and it's probably not appropriate with the stuff going on with Alaska Airlines. But in order for me to make sure that my children are safe, I need to put my mask on first and then get their mask on. So we've
Agree.
got to make sure that we're protecting ourselves. If I'm in a situation, and I've been there before with clients where we just go and say, "Hey, you have a business associate agreement. They messed up. We all have to report this, but they're getting all the blame."
Oh yeah.
Because they said
Yeah.
they were doing all this stuff and the breach happened on their end.
As a business associate, though, let me ask you this. Let's just say uh, I'm an MSP and
Yep.
uh,
You could
my,
be a PEO. I
well, let's just say,
mean,
well, you know
but you
what?
could be any of these
Yeah.
things. And
Well, let's just say screw up on our end, right?
yep,
Patient health information was exposed, hacked, et cetera, whatever.
yep,
Individuals were affected.
yep.
What is my process to go about
It's
and
the same
reporting
as the
this?
covered entity.
Right.
Except now, not only do you as the business associate have to inform all of the patients, but you have to inform your clients that are
Got to
the covered
inform the client.
entities. So
Yes.
not just the MSP, but let's say this happens to a billing company, which there's a few on there. Let's say this is a health plan. There's a few on that list.
Yes.
Then I've got to inform everyone that could be affected. So when Allscripts, I love the Allscripts example because everybody knows Allscripts and Veradigm, which owns Allscripts and
Big
Practice Fusion now.
organization.
A couple years ago, when they had that ransomware situation, they had to let all of the providers know, and then they had to let each and every individual patient know. And then they had to report that to the federal government and get their slaps in. So we want to make sure that this is a situation that the providers are covered. So if I am a 1099 provider, okay, like we've been bashing on the vendors for a little bit.
Yes.
Let
Yeah.
me give you an easy way out. If I'm a small IT company, if I'm a small billing company, if I'm a provider, if I so I'm working from home, radiologists work from home a lot, and they just work with a couple different imaging centers. Everything's coming into their house. There's easy ways to deal with this. One, if you work from home and you have a healthcare practice or you work in healthcare, you should have two separate Wi-Fi's going on, just like if this was your office. One for personal, one for business. One that's for business, you consider that your clean room, just like a surgery room. You
Mhm.
don't let dirty devices into that Wi-Fi. You shouldn't need much bandwidth because most people aren't doing a lot of crazy work from home. It's usually a laptop or a laptop and a desktop because you may be multi-screening and doing multiple different programs. But you shouldn't need much bandwidth. It won't affect you anyway. Most modems, and I say most because you never know what you're going to find in some more rural areas, but I would venture to say now in 2024, almost all modems can deal with multiple Wi-Fi signals and rooms, more or less, for lack of a better term.
Right.
So you protect yourself by that, and then you go and figure out what it is that you need for your work. Nowadays, most people just need a $300 desktop or laptop that's basically a dump computer. I need it to run fast and run these programs, but I don't need it to store a lot of information. So you have that one as again, it's a write off tax wise, right? Because it's a business device, but you're only using that for business. You don't have your Amazon, your eBay, your personal emails. You're not paying bills on that. You're not. This is just for work. This is my Acme Core laptop, you know. Heads up to any of those Looney Tunes references. And then you have your home
Iconic.
device where you've got all your kids' cell phones and tablets and your spouse's stuff and your Xboxes and PlayStations and so on and so forth, and your personal cell phone. When you get home, it automatically connects to your home Wi-Fi, not your work Wi-Fi at home. Those are easy things to do. There are working with IT companies. You can leverage a lot of the passive monitoring and passive antivirus just to make
Antivirus,
sure
yeah.
that you're covered. If I'm a one doc shop, but I'm a 1099er, the likelihood of me being a target of a breach is very small, but it's still there. If I show that I'm trying to do the best that I can within my resources, again, it's just like a small office. I can defend that. I can get a lawyer. They can say, hey, look, they intended to do A, B, C, and D. They just don't have a $10 million budget just for compliance, like some of these hospitals or insurance companies should have. So it's one of those kinds of situations where help me help you as a consultant, as someone who works with healthcare attorneys, as someone who does audits into the systems when a breach occurs, because the first thing you want to do is make sure that all of the holes are plugged. And realistically, when you get me coming in after a breach has occurred, you want me to find every hole there is.
And for those of you that that might have missed, Jose is a consultant and also conducts security risk assessments for healthcare practices and business associates alike. And talk a little bit about that. Your third party, it's considered a third
Well,
party
so I mean,
assessment.
if it's better to have an SRA beforehand rather than after, but we can really dive into that some other time because we got so much to
Sure.
go for with this. But to keep it short, it's just an overview of how your practice is doing on HIPAA security specifically. But usually when I'm going in or my team's going in, we look for other things as well, just to give you a heads up if there's anything glaring about OSHA or HIPAA privacy or OIG stuff. And even just basic human resources or different things going on with the practice that we see. We're like, hey, maybe you want to look at that, or hey, maybe you want to look at that. You brought us in for this, but heads up,
Right.
nobody's perfect. It's just the way things are. So sometimes it's nice to have fresh eyes.
And you don't want to be
Um,
perfect either, because if you're perfect and you
no,
get inspected, then well, they're gonna
well,
be
the
they're gonna
human
be
element's always going to mess things up.
of
Like I've
course.
just been doing an SRA for a client last month. I started it and walking around. All the employees know what they need to do and what they're supposed to do. All the providers know what they need to do and what they're supposed to do. This is an office that has devices in each exam room. And
Hmm.
this company left the EHR open
Uh,
on that device, and the device was unlocked, and the patient had left to go to the bathroom, and I was just looking around. I didn't even know there was a patient that was assigned to that room, but there wasn't a provider, there wasn't an employee, nobody was in that room when I
yeah,
was
it's got
doing
to
the
have
audit.
some sort of locking function on it.
It's
This is
gotta be
a lot of
locked.
this
And
common sense stuff, just like that.
yeah. And I guarantee you that the MA or the RN that was working with that provider knows this stuff. And the provider's like, I don't care. I need to see 45 patients today. Leave it open so I can just go in, do what I need to
So
do, and move on.
exactly,
So
one
it's,
less one less obstacle, right? Plugging in the
yeah.
password on the
So,
phone.
but again, it's the catch 22, right? It's the
Sure.
constant balance of when is it so secure that I can't access it versus it's so insecure anybody can access it.
Right.
We gotta find the
Fine
right
line.
balance and document why we're doing such a thing. If we document, hey, we're doing this because of A, B, C, and D, and we know that these risks are one, two, three, and four, then we can try to mitigate these risks and balance it a little bit closer together rather than having like a straight teeter totter
Agree.
for anybody that grew up in the 70s, 80s, and 90s when there actually were playgrounds. Um,
So
so,
I
what else we
just
got?
threw this up. I know we were talking about the breach portal, but the bottom
Yeah.
line is, I mean, these fines can get crazy, right? Five and a half million for
So, again,
something as simple as this Blackhawk company, which I believe they're a EMR company.
I, I've never heard of them,
There
honestly,
was
but
no, oh, I don't think they're in business anymore.
probably not after $5.5 million.
But Advocate had to settle because they didn't have a written agreement in place. So it just was and that just all goes back to it.
That is
Have an
wild.
agreement in place with your business associates.
That is wild.
It
And
is.
you know what probably happened? Advocates lawyers, after they got that civil penalty from the federal government, probably try to go to Blackhawk and be like, pay me everything.
Yeah. No.
Because that is a wild number. But the thing is, you get there so fast because the way the federal government does this math is you go and say, hey, well, guess what, ladies and gentlemen? It's $50,000
Right.
per incident.
Per
You have
incident.
500,000 incidents, ladies and gentlemen. That's what, 2.5?
It's a lot. I'm trying to remember the exact number of patients that were affected by it, but it obviously astronomical
I mean,
for the
I'm
fines
just,
to end up that at that level.
yeah.
Um,
No, I'm sorry. Yeah, you get to astronomical numbers real fast. And then the federal government says, "Well, this is how much you owe me for messing this up. But I'm gonna be nice."
that's exactly.
Um
So I did not see the initial. It's always the settlement, right? So what
yeah,
was the
yeah, they
initial?
only show you the settlement amount. And
I
you're
it's
like,
funny for this one.
"Holy cow."
I
Which
couldn't
means
find
that guess. It's pie in the
easily
sky.
double.
No one will ever admit what
I
the
would
initial number was.
I would say
But
double
you
or
can
triple that.
easily say double it.
Yeah,
Easily say double
easily.
it.
I believe it.
Because then the lawyers and the accountants come in and they're like, hey, if you do this, the impact to the community, because we're going to have to sell the practice or we're going to have to close the practice and all of these things. And hey, maybe it wasn't all my fault. Maybe it was a little bit of this and some factors that
Right.
nobody could control. And the bad person that hacked us is in Russia or China or Prague or whatever. We're never going to get a hold of that person and we're never going to be able to bring that person to justice. So what if you know what I mean? Like the negotiating
Yeah.
game just starts getting
Starts.
wild.
It,
It starts getting real wild when you see this stuff and you're just like, these numbers
Given the
get so
time
high like
frame of this
this.
too, of
Yeah,
going
you're just
back and
getting so
forth,
flippant
going back and
about
forth.
$50,000.
Yeah. It's nuts.
Like $100,000. You're just like, how can you be so flippant negotiating? Oh,
Bottom
we're just
line
gonna take a
is
quarter mil off
don't
this.
end up in this situation for
Yeah.
something as simple as having business associate agreements, right? So that kind of leads us towards the end here. Obviously, solutions. Number one, if you don't have a business associate agreements in place with your subcontractors, your vendors, make it happen. Got to have it in place. It is a requirement of HIPAA. And obviously, I think at this point we've kind of beat it to a pulp, but we've showed you fines, we've showed you the breach portal. I mean, this happens all the time. Make sure it
So,
doesn't happen
but
to you.
the popular question I get though is, well, how do I get them to do that? Well, just like the federal government, we've got the carrot and we've got the stick. The
Yep,
carrot would be, do you want to keep this contract in place? Then you got
ex-
to sign a business associate
exactly.
agreement. If the
Yeah,
stick would be, if you screw up, this isn't on me. I want you to be held accountable for everything that you do. And
right.
I need certain warranties because the federal government is requiring those warranties of me. And my carrot and my stick are macro and MIPS and jail time. I don't want jail. I'm too pretty to go to jail. I look good in an orange shirt, not an orange jumpsuit, right? So, so we want to make sure that we're protected and we're documenting things as we go. Realistically, though, I mean, most vendors don't have a problem signing it, and sadly, it's because they don't even look at it. They know it needs to be signed in order to execute the
Exactly.
contract. The ones that do will come back and say, hey, well, what about this? I want to modify this language or modify that language. This is where you need to take a look and see what it is that they're proposing. What is it that they're trying to limit? And I promise you, they're always trying to limit their exposure.
Limit their
Always
liability.
trying to limit their
Absolutely.
exposure, as anybody would.
Yep.
So you just want to make sure that, hey, the modification that they're suggesting, is it something that we as a covered entity can live with? And if it's not, then you basically tell them again, look, these are my non-negotiables. You either got to get this going or we got to find somebody else.
And don't be
Sadly,
afraid
that's just the
to
way
be
of
in
the
that
world.
scenario too, to say no. I mean, that's really what it comes down to. I'd asked you
That's,
earlier
I
if the
mean,
business
it's,
associate is 100% absolutely unwilling to sign an agreement, don't do business with
it's,
them. Bottom line.
yeah, you can't do business with them.
Yeah. Yeah. Otherwise, you're putting yourself liable.
Yeah,
So
you're putting yourself in a bad spot. Like I said, the popular ones that I see that most people will not want to sign them, or the biggest problems have always been my printer leasing companies as of late. Every once in a while I'll get a 1099 provider that doesn't want to sign one, but then I'm like, look, man, you're a covered entity. We got to do this.
I've seen
If you're a provider,
small mom and pop MSPs that are unwilling to sign because they
well,
just
and that makes sense because they don't want the liability.
right. But they just
But
don't. They completely just don't understand what a business associate is, and
so,
when
and
that's the
that's where
case, then you really want to run away.
well, and that may be the case where it's like, hey, I this is their first foray into healthcare, which about 5 years ago there were a
Sure,
lot of IT companies that had no experience in healthcare. So they were just doing IT and didn't understand that there were reporting requirements or documentation requirements in IT for healthcare. So there's different things that got to get documented. But again, it's it's manageable. There,
of
everything
course.
is manageable. And if anybody has any questions or has needs any help with that stuff, I'm more than happy to just have the conversation of, hey, well, how do I deal with this? Hey, this person is telling me that they're not a covered entity. Like we had one client in the consulting firm that was almost a DME, but not really a DME because of the products that they provided. But the problem is that they're capturing so much information that they are still a DME. So even though they're like, oh, well, PCI, we have to comply with PCI. And I'm like, what is the bloody difference? If you have everything for PCI, you have everything for HIPAA. If you're
Sure.
doing it all, you're doing it all. Just show me that you're documenting it. So it's just a matter of finding out whether you're one of those loopholes or just straight up, I need to have this done. And then finding the most economic way to do it because no one has unlimited resources, not even the federal government, which is why they're looking to do all kinds of fun things for the Medicare program. But that's a whole nother bag of tricks for a
That's
different
a
day.
whole nother topic right there.
Yeah, it's a whole nother bloody problem. Um, but yeah, so I mean, I know that Ray is also really effective at navigating everybody through the business associate agreement. I would
I was
probably
going to
say based
add,
on
Jose, and I know you mentioned this earlier, and here at EPICompliance, that's one of our product offerings. Essentially, we offer business associate agreement templates. We actually have a process. It's pretty much identical to DocuSign, where we provide our customer with a business associate agreement template. You fill in the blanks as to who you want it to go to. Boom, it's going to go to that person. Obviously, your vendor, your subcontractor, etc. It's going to go to that person's email for an electronic signature. Business associate signs. Guess what? They have a copy for their records, and then boom, copies then sent back to your EPICompliance account for your records. So everything's stored safely and secure. All those contracts are on file. Push comes to shove, we're dealing with some sort of inspection. Guess what? We're going in and looking at those contracts. So um, that's what we
I
do
would
here.
venture to say that what 15-20% of the calls you get and with regard to your clients is BAAs and business associates
Of
and getting them to
course. I
sign
mean,
it.
it's such an important piece. I mean, it's a must. And like I said, we have an array of products, but our EPICompliance Pro package, it's going to include your training. And again, we cover all the federal requirements in terms of OSHA, HIPAA privacy, HIPAA security, Medicare waste, fraud, and abuse compliance. But our pro package, it includes everything, right? If you're a practice looking to be compliant, this is your one-stop shop. Business associate agreements, training for your staff, ongoing tasking, security reminders, and obviously the most important, updated policies and procedures. So um, like I said, that's what we do. That's our MO here at EPICompliance. We want to streamline the compliance process. Listen, especially if you're a smaller office, maybe less than 10 employees, who's managing your compliance? I mean, at the end of the day, if you're doing it yourself, I commend you. But Jose, you and I know, Jose, that that's a lot, right? Especially if you're an office manager and you're dealing with
I'm
employees, you're dealing with
no.
patients, etc. It can be a lot. And to be honest, compliance, it's not going anywhere. And as a healthcare provider, as a business owner, It's one of those costs of doing business. You got to have it in place, and that's what we're here for at EPICompliance, to make that process simple for you. And also, we'll add to as well. Always mention this on our webinars. Shelly can attest to this as well. Welcome back, Shelly. But we do offer free OSHA training as well. There is a link in this slide here, epicourses.com. There is a free OSHA course that we offer. Hey, if you haven't done your OSHA course this year, why not take advantage? If you're a healthcare student, perhaps that might need this for your transcript or for a class, why not take advantage? It's completely free. You take a lecture, you take a test, you get a downloadable PDF certificate at the end. Other than that, if you guys are looking for something more robust or looking for HIPAA training as well, we do have a training bundle. It's $36 a seat, includes your OSHA, your HIPAA privacy, HIPAA security, and Medicare compliance course. And same process, lecture, test, get your certificate at the end. Other than that, I'm going to open it up here for an FAQ, but I just want to add as well, if you guys have any questions, concerns, Jose and I are always here to help. We do free consultations. If you want to reach out, hop on a call with us, be more than welcome to, and discuss your needs. Just reach out to us. And again, everybody that's been on this webinar is going to receive correspondence from us, so that if you do want to schedule a meeting, there'll be a calendar included. But as I mentioned, I want to open up for just a quick FAQ. If you guys have any questions, go ahead and put it in chat for Jose and I, and we'll gladly answer.
One that normally doesn't need to be worried about, though, is anything that is incidental. So you've got your cleaning company. You don't need to worry about a BA with a cleaning company.
Good point.
Because they're not really going to be touching anything like that or having access to it, other than as they're cleaning things around the office. That's considered incidental, so you don't need to have a BA with them. You can if you want to, but it's really not required.
Shelly, thank you. Love to hear good feedback.
Sorry about that. My 2-year-old just got home.
Hold on 1 second. No worries. Nobody's got any questions? We'll leave it open for another minute or two.
Hopefully that.
If we don't get one question, Jose, I got one for you.
All right. Well, why don't we answer that while somebody's typing?
So let's just say I'm not a user in EPICompliance, right? I'm exactly what I mentioned earlier. I'm a small practice, kind of doing things here and there on my own, in terms of the compliance gig. And I'm just now learning about these business associate agreements, and I'm trying to create maybe an effective template of my own. How can I ensure that I'm creating the right template, or do you recommend consult an attorney?
So there's a couple of ways to do this.
Yeah.
If you're not an EPICompliance customer, but you want to do this properly, you're either going to hire a consultant like myself, or you're going to hire a lawyer to do this stuff for you. The reason why we don't normally like to do this, and correction, I don't mind doing them, but it's really not effective for the client, because you're going to pay me, for example, $4,000 or $5,000, put together the whole package. Mm-hmm. By the time I give it to you, after having all the conversations about specifics for your practice and so on and so forth, some of the material may be already obsolete because it's taken us a couple months to put it together, and new requirements will have come into place. And you still have to update it and review it every year anyways. So a company like EPICompliance is the best way to do it. You just, for the sake of being a little bit more agnostic, there are other companies that offer similar packages and services at EPICompliance. I would recommend measuring apples to apples to see what's the best fit for your practice. But normally you're going to want a combination of policies, the procedures, and the training all in one spot. Now you're going to get different pieces of it when you go to different things. You see a payroll company that has some of this stuff. Well, the only stuff they have is for the HIPAA security things that have to do with HR. If you are using uh,
Stericycle
yeah,
or
Stericycle, you're
OSHA.
gonna
They
have
have a
yeah,
OSHA piece.
yeah, so it's no one is going to hand this stuff to you. So it's you really got to apples to apples it and be like, all right, what am I missing in my compliance puzzle? And then put it all together. If I'm looking to do this all on my own, the problem is that you're playing Monopoly with the federal government, but you don't know all the rules because there's no way to know all of the rules. I've been doing
Right.
this almost 20 years and I don't know all of the rules off the top of my head because there's so many of them. Just for HIPAA security,
Yep.
there's 280 different measures that we got to meet. How am I supposed to keep up with all of that? You know what I mean? Like, there's just no way that I'm going to be able to keep up with, oh, I got to document this. Oh, I got to track this. Oh, did this change from last year? Oh, do we need to do this? Oh, we got a new system or a new device or a new this. We need to add this to our inventory list. Is this set up with our IT? Is that, there's so
So
many
much.
there's
Mhm.
so much to it that it really just you don't have time. If you're an administrator in office practice or in an office 40 hours, 50 hours a week, because let's be honest, most practice managers are there 60 hours a week. You're spending 55 of the 60 hours putting out stupid fires with the providers, with the insurance companies, with the
Employees.
employees,
Mhm.
with your vendors. You don't have time to do compliance, even if you want to.
Yeah.
So it's just finding the way to leverage the team that you have and the resources that you have to be most effective. And that's really where we as a consulting company is really come into play because we'll come in and we'll be like, hey, for free, we'll sit down and talk with you for an hour and say, look, these are the resources you've got. This is the stuff that you're doing. Let's find what you're already doing and make one tweak. And all of a sudden you comply because you're documenting it. Because a lot of this stuff is common sense. It's just proving that you're doing it.
Shelly, it's never a bad thing to overutilize.
Yeah, Ray's there.
Especially when it
Get him.
comes to this,
Ray's
especially
there.
when it
Get
comes
him.
to the compliance. It's
Get him.
always better to overdo than underdo. So props to you. Get them to sign it.
Yeah. So, it looks like we're almost out of time. What's next week's topic, Ray? I forgot.
Good question. We were talking about, was it consent to patient health information? Patient health information?
Yeah. We're looking into a consents.
Yes.
Yeah.
Which is another HIPAA security related topic.
Well, I
And
mean, it's
a
not just HIPAA; it's a couple different things
little bit.
too. But
Yeah.
yeah,
Yeah. Yeah.
we'll keep going through HIPAA for a little bit more, and then we'll probably switch it up to go to OIG since we're reaching macro season.
Yeah, I was gonna say, Jose, you and I need to get together and talk about some more topics because after this one, we gotta gotta start lining them up because
Well, and if
and
anybody's got any topic ideas or something
yes,
they want us to address and dive
yes,
into a little bit, you're more than welcome to offer up the idea, and we'll probably just take it because I mean, if one person has the question, more than one has the question. So
yeah, absolutely. If you guys have any topics or anything that anything compliance related that you think would be something that's valuable to not only yourself but to the audience, let us know. You can reach out to us via email. You can throw it in here in chat. But would love to hear that feedback. And other than that, Jose, I think we'll wrap things up for today.
yeah,
Everybody, I appreciate your guys' time. Shelly, you especially. Thanks for joining in with us. And hope to see you on the next one, by the way. And if you guys need anything, just certainly let us know. We're going to be sending out some correspondence here with some links, obviously, to the next week's webinar. And hope to see you all there. And if you guys have any questions, please feel free to reach out to Jose or myself. We'll be happy to help you. All righty. Well, Jose, stay dry, and I'll see you.
yeah, you too.
Yeah, I'll see you next week. Take care, everybody.
Take it easy.